Who thinks they're ready to try microneedling? Well, if so, you have found the right video, because today we're going to be talking all things microneedling. I'm going to be explaining what microneedling does and all the benefits it can offer. What exactly is microneedling? Well, it's a procedure that involves devices that have these sharp, thin, needle-like tips that puncture the skin at a very specific depth and essentially elicit a controlled form of skin injury. While that may sound like, oh my gosh, it's actually a good thing because it leads to healing and remodeling pathways in the dermis, which is the deeper part of the skin, that ultimately stimulate new healthy collagen production as well as elastin production, essentially for skin rejuvenation purposes, for improving the appearance of wrinkles and fine lines through collagen induction. But it has since grown in popularity as a treatment modality for a wide variety of different skin conditions, especially those where the underlying root cause pathology resides in the dermis. For example, microneedling is actually pretty helpful for improving acne scars, as well as other types of scars. Microneedling is pretty useful in improving the appearance of stretch marks, likely because stretch marks essentially are a form of a dermal atrophy, loss of the supportive framework deeper down in the skin through rapid stretching forces. Microneedling is also very useful for different hair loss disorders. By stimulating these healing pathways, it may help in bringing in nutritive and growth factors to the hair follicle to recover healthy hair growth. Some even are able to get good success treating axillary hyperhidrosis, which is a fancy medical terminology for excessive sweating under the arms, with microneedling, probably because it has the potential to target the deeper layers of the skin and potentially the sweat gland. Microneedling also is pretty useful for improving various types of hyperpigmentation, such as post-inflammatory hyperpigmentation. But the benefits of microneedling don't stop solely at improving these skin and hair disorders, but rather microneedling can be a way to enhance penetration of topical medications or active skincare ingredients. One you may have heard about is a lot of people utilize microneedling to enhance delivery of the hair loss medication minoxidil. And so, as you guys know from my videos on minoxidil, if you've ever watched them, or any of my hair loss videos, minoxidil is a well-established treatment for certain types of hair loss. However, not everyone responds well to it. This may be for a variety of reasons, but some people get better results when paired with microneedling, likely because of a combination of microneedling's effects on stimulating healing pathways alongside the fact that it allows for better penetration into the follicle. With microneedling, you essentially bypass the stratum corneum, that thick waxy outer layer, and allow access directly to the dermis where the blood vessels are located. There are actually quite a few different microneedling devices available, different lengths of needles that access different depths and are better indicated at certain locations. In addition to that, microneedling devices can be combined with other skin rejuvenating, skin treating technologies such as radiofrequency. The advantage of pairing microneedling with radiofrequency is that radiofrequency is a type of energy that essentially heats the deeper layers of the skin to stimulate healing pathways. And this energy extends below the tip of the microneedle. So you get not only better improvement in terms of collagen and elastin production, but you also get a subtle skin tightening effect, which is desirable for a lot of people seeking rejuvenation. Not only that, radiofrequency microneedling has been shown to be pretty helpful actually for treating various acne scars. In addition to being helpful for acne scars, it essentially exhibits a thermal inhibitory effect on the sebaceous oil gland, leading to a reduction in sebum, aka oil, which is a big player in acne pathogenesis. Microneedling is also combined with different LED therapies, such as blue light for the treatment of acne, and red light for further photobiomodulation to trigger collagen production, anti-inflammation, as well as healing pathways. Now, I have a lot of videos on photobiomodulation, but you can imagine that when paired with microneedling, it may potentially offer even better results. What are some advantages specifically with regards to microneedling? Well, first of all, it's actually a pretty safe procedure overall with a very low risk of adverse effects. Maybe some discomfort, although that will depend on the location and the depth of needle needle. Also, it's a pretty low risk for post-inflammatory hyperpigmentation. It's a cost-effective intervention for a variety of skin issues. It doesn't take that much time to perform. It can be done in office, so it doesn't require you to go to the OR or anything complicated like that. It's also a suitable intervention for those who have very sensitive skin that's prone to irritation, as well as areas of the skin that are more delicate, such as around the eyes. It's even been investigated as a treatment for rosacea. It may stimulate some anti-inflammatory pathways that are helpful for reducing rosacea severity, but more research, of course, is needed. But microneedling is not all sunshine and rainbows. There are contraindications, basically situations or groups of people for which microneedling is not a good idea. Number one is if you have an active acne breakout. Probably not a great idea to be dragging this tool across the surface of the skin. It likely can aggravate existing breakouts. Number two is if you're someone who deals with herpes cold sores, especially if you have an active herpes outbreak, because if you microneedle in the area, viral particles can be introduced into those little puncture wounds, and you can get a more serious skin infection that requires antiviral medication to treat. You would also want to avoid microneedling if you have warts. Now, when you think of a wart, maybe you think of the bottoms of your feet, your hands, your fingers, but it's actually not uncommon to have warts on the face. Little flat warts, especially in the beard area. They get inoculated there as the razor from shaving is dragged across the skin surface. So if you go microneedling, well, you could potentially get more extensive warts distributed across the skin surface. While microneedling is a great option for treating various different types of scars, if you have a history of forming keloid scars, it's not a good idea to do microneedling. If you have an active, poorly controlled chronic inflammatory skin condition such as atopic dermatitis, other types of eczema, or psoriasis, microneedling is probably not in your best interest. I've mentioned this before anytime I talk about psoriasis, but it is a condition that exhibits something known as the isomorphic response, otherwise known as the Kebner phenomenon, wherein if you have any form of skin injury, I mean, we're talking just scratching your skin even, it will actually elicit more psoriasis. So as you can imagine, controlled wounding of the skin is not a good idea with psoriasis. If you have underlying immunosuppression, poor wound healing, you're on chemotherapy, or you're undergoing radiation therapy, it's not a good idea to pursue microneedling in these situations where you have overall poor healing due to either your immune system or, for example, radiation treatment. Now, with microneedling, it does create some pinprick bleeding because it is causing a controlled form of skin injury in the deeper layers of the skin where the blood vessels reside. If you have a problem with clotting, you bleed easily, or you are on anticoagulation, basically medicines that thin your blood, it may not be the best idea to have microneedling treatments done. While microneedling is generally safe, it can go awry, and there can be unfortunate complications with microneedling, whether it be garden variety microneedling or microneedling with radiofrequency, you name it, you can have some adverse effects. So one of the more common adverse effects that many people experience, most people I would say, is redness, irritation. Fortunately, that's temporary. It only lasts a few hours. Now, you can also have some peeling, flaking of the skin because it sort of exfoliates to a certain extent, and that may last a couple of days after you've had microneedling. For the most part, that's about it in terms of adverse effects, although there are a whole host of other adverse effects that happen in rarer circumstances. For example, you can have it trigger reactivation of herpes virus and give, again, a more extensive herpes viral infection of the skin that's quite serious. You can also have a skin infection. I mean, you're causing little wounds to the skin. Now, I've mentioned this before, but a lot of people carry certain strains of staph bacteria naturally in their nose. They're colonized with it. And so if you are having microneedling done in the area, it is possible that you introduce that staph bacteria into the area that was treated and you get, impetigo, which is a type of skin infection. It's possible that microneedling aggravates any underlying acne. You develop some breakouts. Hyperpigmentation is pretty uncommon, but it is technically a possibility and is probably even a greater risk if you are pairing microneedling with radiofrequency. Depending on what topicals you apply and how soon after the treatment you apply them, it's possible to have an adverse reaction, either excessive irritation due to the now enhanced penetration of those topicals, or you actually can develop what's called a foreign body granulomatous reaction if they penetrate too deeply. This has actually been observed in people attempting to do at-home microneedling, the development of little foreign body granulomas. In rare circumstances, you can develop what's called tram tracking. These little bumps in, well, what looks like tram tracks in the area treated. That's a side effect that can happen if the microneedling device is used with the wrong depth of needles or you press too firmly during the treatment. You also can be allergic to materials in the needles, and that likewise would cause a pretty serious skin inflammation, irritation, and aggravate things. Now, it's best to see a qualified healthcare professional for administering microneedling. However, you also can buy a microneedling device at home. They have a variety of different types of devices. Many of these, honestly, probably are helpful for exfoliating the skin. The needles don't often penetrate to the appropriate depth to get that collagen induction, ultimately helping with things like wrinkles, fine lines, and essentially rejuvenation. But they may help with exfoliating. Now, you can buy devices that do get to that depth. However, I do caution against using that. A lot of adverse effects are seen with people doing it themselves at home. For example, there are infections. And whenever I point this out, I will often get comments of people saying, well, yeah, if you don't clean the device properly, of course infection is a risk. But you can clean the device and it can be super clean and you're still at greater risk for infection in that area, especially if, like I said, you are prone to cold sores or you have staph bacteria in your nose that could lead to impetigo. So it's definitely not something I recommend doing at home, but a lot of people do. And, you know, it's one of those things where many people will do it and have no problem doing it, but the risks are there. The risks do pop up doing it at home. So obviously I'm not going to recommend people do it at home. Those risks not only include infection, but you also have the risk of a granulomatous reaction, a foreign body granuloma, which can certainly happen. I've seen that myself firsthand from people doing microneedling at home. So another reason why I caution against it. All right, guys, so that's what I wanted to talk about today with regards to microneedling. You know, it's a really neat and helpful intervention, treatment modality, and I look forward to seeing what the future holds for microneedling because honestly, even in the past, I would say 5 or 6 years, there's been a lot of novel developments in the realm of microneedling and a treatment of a variety of different disorders. I hope this video was helpful and answered a lot of the questions that I frequently get with regards to microneedling. If you all enjoyed it, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye.